I was watching. Did you see the have you seen the program on Netflix Live to 100?
Yeah, yeah, I've seen a couple of episodes. Amazing.
Wasn't that amazing? So basically, the show is he was a journalist and has now become like a quite a prominent researcher in America that basically has been studying blue zone areas. Blue zone areas being where you have a disproportionate number of centurions in a population. So he travelled around the world and went to these different blue zone areas to try and see if there was a kind of correlation between these areas where people live to a very old age, and some really obvious stuff in there, right? Like as you would expect. Okay, so the diet, there's plenty of fiber, there's not huge quantities of meat, there's the things that you would kind of expect, but there was some really fascinating stuff that kind of came out of that. So one example was there were these villages in Sardinia, all bunched quite closely together, all ate the same diet, all did similar things, all had similar jobs, but one village just had a disproportionate number of centurions. And basically, the outlying factor was the village was on a very steep hill. You can get so bogged down in specific treatments, specific conditions, all of those sorts of things. But I think what that program did was really kind of position this kind of much more systemic thought around the importance of a purpose. Essentially, that steep village just basically meant that everyone, right up into their old age, had a load of zone 2 exercise.
Yeah. And loads of weight bearing exercise as well, right? Because walking up hills is much more strenuous on our muscles. And like, I think what you're absolutely right. And I'm sure you were around in the industry when people were trying to, and I'm sure they still are trying to sell special compounds from blue zones. And of course, what we need to recognize is while there are common threads across all of these blue zones, all of them eat very different diets, largely plant based. And by that, I don't mean vegan. By that, I mean mostly eating plants, some animal proteins, plenty of eggs, plenty of fish, hopefully that kind of thing, but nothing that's anything like the processed food that we eat now. And there will inevitably be in those blue zones as well, people are locally growing and harvesting their own food, right? And that means that there's no air miles on it. All the nutrients are there, the soil's not depleted, all of these things that kind of nudge. And there's so many things that we can't control. We can't live in blue zones. You could go and live in a blue zone. It's probably too late for you already now, but you could go and live in a blue zone. But ultimately, it's about trying to learn those lessons. And one of the big lessons I think people need to take from that is also about lack of stress. You know, people in those areas are not people who are stressed about emails or spreadsheets or these kinds of things that we worry about day to day. And they also feel very connected to their community. They are doing manual labor until they're really quite old, growing things and being very active in the community and feeling needed and wanted until much later in life. And that's where we can really take these lessons about the importance of our holistic health, including our mental health and well-being, into my clinics and into the general population to say, look, you can pop as many supplements as you want to, and you can go in the sauna every day and start your day at 6 and do your manifestations and your gratitude and all the things you're supposed to do on social media, and you can have the six pack and all this kind of stuff, but the chances are you can't do that and have all the other lovely holistic things that are needed in your life in order for you to really enjoy good health into late life.
And I think that really touches actually on this kind of like balance of accountability at the same time. I think it's very easy to have a particular pain point or be dissatisfied with something and be very hyper focused on that individual thing, but actually also each individual person taking a broader accountability for all of the things that need to come with it, like a recovery. There are some, like you're talking about, like with H. pylori, there's going to be a specific antibiotic, and you are going to have to take that antibiotic for a couple of weeks. That's the intervention from the NHS, very helpful. But what can you do around that and outside of that to kind of aid recovery? I guess it's the same with like hip replacements, or like the outcomes aren't dictated 100% just by the treatment.
Yeah, absolutely. And it's, that is can be said for any condition. If diabetes is quite a nice example. You'll have medications thrown at you if you're diagnosed with diabetes, but if you don't change your diet, those medications inevitably are going to continue to escalate through the course of your disease course, essentially. Whereas now we also know that there are dietary treatments that can reverse diabetes, which we offer in the clinic, which actually some of that power is in your hands and we can take it. But I think obviously, and we have to, I always want to caveat this by the understanding that not everybody has all the power over their own food and the things they can do and the things they can afford to do, all of that sort of stuff. So, if you are someone who is eating from a food bank, the chances of you being able to reverse your diabetes through dietary interventions, next to nothing. So we have to understand the environment we live in now. But that said, I think, a lot of this, for those of us who are able to, being able to manage our own health as much as possible and tap into, or what can I do to further support this, I think is a really powerful and important message.